American healthcare is broken, but not for acute issues.
And I don't disagree with most of the stuff you say, but one thing I do want to touch upon is doctors and their salaries and like kind of how that plays in with insurance companies. Because like one argument that I've been witness to is doctors, first of all, they have a lot of debt when they go through school. They have like undergrad, medical school, residency. If they don't have a lot of support, that's a lot of incurred debt. And the only way to really pay that off is to have a high enough salary in which they can live like a normal life. When you get to a point where you like injure your leg or something and you need a surgery, it's expensive, and it's kind of a game they play with insurance companies. I was wondering just kind of your take on that. Like, doctor salaries, should they be lowered or higher?
Well, the answer is depends. But so let me be more specific. American healthcare is broken, but not for acute issues. There's two types of healthcare. There's chronic and there's acute healthcare. We have the best acute healthcare on the planet. We have some of the worst chronic care. So chronic care is where doctors are not clinically trained to treat because we are so acute focused. So acute focused training is important, but it always is like diagnose, treat, give them drugs, move on, right? So chronic diseases like rheumatoid arthritis or lupus or any one of these things, it's not enough just to take a drug. It's a recurring issue that involves 1,000 different factors. And doctors, to their credit, they're just going after their training. And a lot of these doctors are like, hey, if there's not a tumor to remove, right, or a surgery to be had, I don't have time for you, basically. Go take this drug. And that's actually not the best way to go up against most chronic issues. Most chronic issues are a byproduct of lifestyle choices. Type 2 diabetes is almost completely because people have eaten poorly their whole life, right? So doctors, in my opinion, we need to have better doctors that understand chronic care with more patients, more naturopathic solutions, more understanding of people's complex issues. But on the acute side, we need more competition and more price transparency.